Hello, I'm Dr. Terrence O'Malley, Medical Director for Non-Acute Care Services at Partners Healthcare in Boston. And I'd like to talk to you about the difficulties we had within Project IMPACT, improving Massachusetts post-acute care transfers, and deciding which transitions of care we wanted to look at. There are so many and so little time. What we did is we created a grid that included all of the receivers of patients and all of the senders of patients, creating 144 cells because there are 12 of each. And the receivers were the acute care hospital inpatient floors, the acute care hospital outpatient testing and treatment areas, the emergency room, and then the post-acute care sites, LTACs, IRFs, skilled nursing facilities, extended care facilities, hospice, and home care. And then in addition, because we had a broad definition of what constitutes post-acute care, we included the primary care physician in the office, the community-based organizations, and the patient and family at home. So this 12 by 12 grid gave us 144 possible transitions, and so we prioritized them. On the next grid, it shows you the results of our prioritization. We gave a red bar to any transition that scored high in one of three categories. Those three categories are the volume of transfers, the clinical instability of the patient, and finally, the time value of the information being sent. How important is it to get that information when the patient transfers? Based on this high, medium, and low, we were able to give each of these cells a value, and those that had 3 in the high value section were made our highest priority transfers, and those with 2 of 3 were our next level of transfers. And that resulted in the following grid, which just shows you the 44 transitions of care that we are now concentrating on within IMPACT. What is important about this is that you need to focus in on those transitions of care that are most important to the goals of your program. Since we're looking at the entire transitions of care among all post-acute care facilities and the acute care facilities, our list of priority transitions is quite long. Hopefully yours will be a little shorter.